guys, it's Finn. A little update regarding lower surgery. I saw Dr. Dean yesterday and made my referral official. Scary stuff. So this means that now I need a second opinion, because they're still doing that at the moment. So Dr. Dean has now referred me to a doctor someone in Bristol. I think it's Dr. Dougal, but that can't be right. It's Dr. someone anyway in Bristol, who I have to go and see and tell him my life story and talk about my penis. And then he will let Dr. Dean know if he's in agreement. As long as he's in agreement, then Dr. Dean will contact Mr. Christopher and the London team and make the official referral for me to have phalloplasty. It's really weird hearing these words come out of my mouth. It's just like, is this really happening? It just feels really surreal at the moment. Really, really surreal. It's just crazy, you know, it's just, in some ways it feels like it was just yesterday that I was coming out and it feeling like it was going to take forever to do anything. And yet here I am, 8 months post-top surgery and about to embark on lower surgery. So anybody that's like waiting and you feel it's never going to happen, trust me, it happens, and when it does, that wait just feels like nothing. It's really quite bizarre. So yeah, okay, so I feel when I last updated I was kind of quite all over the place about it all still. It's not an easy decision, this, for a huge amount of reasons. It's, you know, there's a lot to weigh up. And not just like whether to have the operation or not, as I've discussed, there's lots of different things within the different stages that have to be thought about, so it's just massive. But I'm just going to take it one stage at a time at the moment and just work it out en route. But yeah, I've definitely kind of like moved away from the real anxious, quite low feeling of just trying to work it all out, and I feel much lighter, and I feel like I've embraced it now, that I've embraced the yes decision, and I'm starting to feel excited, absolutely starting to feel excited about it now. I think for me, as I've shared before, it was a bit of a shock to kind of think, no, I don't want lower surgery, and then all of a sudden to find myself rethinking it, and then to have to shift my head because I was full of misconceptions and myths about lower surgery, and having to work through all of that. So it was kind of quite strange for me, kind of just reordering how I felt about it in my head, and also reordering what I thought the next couple of years of my life was going to entail, because I had this idea that I'm ready for work, want to get out there, and although I can still do that, I've got to do it at a much slower rate now. You know, there's no point me rushing out there to try and get a full-time job right now, because, you know, in a few months' time I'm going to need 6-8 weeks off at least, and that's going to be continually happening, and it's also not going to be good for my mental health, trying to do all of that all at once, get a new job and get a new penis. Oh my god. So yeah, back to the drawing board with all of that. I've started my volunteer work. It's really, really awesome, absolutely perfect. It's with lesbian, gay, bisexual, transgender, questioning young people, 13 to 25-year-olds, and it's just, at the moment, it's just a support group once a month that I can kind of dip in and out of, and just get my feet in there, really, get my feet back in working towards going back to work with people that know my history, know what I'm going through, are fully supportive of that, and I can do it alongside all of my operations, and hopefully it'll lead to a job or open a door somewhere en route. So not stopping my plans that I had, but they kind of slowed a bit, and that's okay. I've come to terms with that now. Yeah, it's fine. So now all I do really is sit and wait. Regarding hair removal, God, this is a really complex thing. It's now, it seems that everybody should be given access to NHS-funded hair removal services. That does seem to be what the interim guidelines are saying, but there seems to be lots of confusion around that within the clinics. Now, the Laurels are great. They've referred me, and I'm seeing a lady at the French Hay Hospital in Bristol on the 3rd of September for a consultation for laser hair removal. Now, the controversy with this is, right, in researching the difference between laser hair removal and electrolysis. Obviously, two very different things, and sometimes, depending on your skin, your age, your type of hair, you have to choose one or the other. You don't get a choice that is as either or. It has to be one or the other. But when the choice is either or, the FDA, the kind of governing body that looks over all of these kind of treatments, only lists electrolysis as a permanent hair removal method. It doesn't list laser hair removal. And looking at it, it does seem to be that electrolysis takes longer but is more permanent, and laser hair removal is quicker, but it can often grow back finer rather than stopping. But it seems that the NHS only currently funds laser hair removal and not electrolysis, which really surprises me, because you would have thought that an FDA approved method would be what the NHS goes for. So I don't know. But anyway, I can't be bothered to fight it. It's, you know, as long as it gets rid of it enough that it's going to be safe, because the biggest issue is having hair in the urethral tube. I'm not that hairy underneath anyway, but as long as I get as much of it gone as possible, so that if it does grow back finer, then I will go and have electrolysis on my penis once I've had it done. I found a clinic, Dr. Curtis actually in London runs a electrolysis clinic, so I would feel comfortable doing that after surgery if needed, because he even uses like a numbing thing first, so you don't actually feel it, which is quite good. So I'm comfortable that if it does mean it grows back finer and doesn't remove it, I'm okay to do it after. My main issue with wanting it done is I don't want anything complicating the surgery in growing hair in places it shouldn't be. It's not good. So I'm glad that ball's rolling anyway. So I'll let you know how that consultation goes on the 3rd. Other than that, now it's just sitting and waiting. I don't really want surgery till after my birthday next year anyway. My birthday's the 13th of February, and as this birthday, my 40th, was kind of overshadowed by top surgery. I'm still recovering. I couldn't do much, so I want my next birthday, me and Nat can go away for a while, have a couple of weeks away together somewhere, and then sometime after the 13th of February. It'll give me time to catch up with all my uni and kind of get myself ready, I think, over the next few months. Because yeah, there's still lots to find out. So yeah, that's my update for now. I will let you know how it goes, and Nat and I am going to do a video about this together at some point as well. And I also want to talk about my reasons for choosing London over Belgium, because I've had a lot of people contact me to discuss the option of going to Belgium for phalloplasty. But I will do a separate video talking about that. Right, I'll leave it there. Mustache. Take care of yourselves, everybody. Speak to you soon. Bye-bye.